Namaste and welcome to Dr. Shah's Clinic. My name is Dr. Shah and I'm a consultant andrologist in Chennai. And in this video, we are going to answer a very common clinical question that I get from my patients. And that is, dear doctor, my semen is watery and I suspect I may have male infertility. Now, a large number of patients who come to a male fertility clinic usually ask this very common question and have serious doubts about their sperm count, especially when they see that their semen has become watery or when they see that their semen consistency becomes more liquid. Now, a very important point to bear in mind here is that the seminal fluid which is ejaculated is made up of fluid contributions from three organs in the body. One, the prostate; two, the seminal vesicles; and three, the testicular fluid, which contains the spermatozoa. So for all practical purposes, studies have indicated that sperm actually only contribute about 1 to 1.5% of the actual seminal volume. And the watery nature of semen does not actually give any indication about a male's fertility potential. Now, if you're worried about your male fertility potential being affected because you're producing semen that is watery, one of the best tests or the simplest tests that you can do to find out whether your semen contains adequate sperm is a semen analysis. So a simple sperm test or a simple semen analysis will clearly tell you whether or not the watery semen contains adequate sperm. Now, as far as from my clinical experience and after all the patients that we have seen with watery semen, most of the time there seems to be no correlation between the sperm count as well as the watery nature of the semen. Now, seminal consistency or the semen constituents or the overall the quality of semen depends on a variety of factors, including an individual's nutritional state, the body's hydration status, the general health of the individual, presence of other comorbid illnesses, and also lots of factors, the climate. There are so many factors, the geography, the ethnic origin of the individuals. A lot of factors actually play different roles in deciding the ultimate constituency or the ultimate consistency of the semen. So if you find that your semen is watery, please do not really worry, do not panic, and do not freak out. That's very important. And there are some online resources which say that watery semen may be associated with the low zinc levels, and because of the low zinc levels, the male fertility potential may be reduced or suboptimal. That's also not true. We have done systematic studies on a lot of male individuals, and we have data, though not yet published yet. We have found absolutely no correlation between watery semen as well as the amount of zinc that's present in the seminal fluid. Although zinc has numerous functions for spermatogenesis, we have found no direct correlation or causation link between the consistency of the semen as well as the zinc levels in the semen. So, however, more than the consistency of the semen, what's more important, however, is the color of the semen. So, if you find your semen to be extremely red in color, or you find semen that's somewhat greenish in color, or you find semen that's extremely yellow, then different colors mean different things. So, for example, if the semen is red in color in the sense, or you find sticks of redness in the semen, that's probably blood, and it's a condition called hematospermia. And there we have to rule out prostate infections, even prostate malignancies in some instances, seminal vesicular infections, and the range of medical conditions including injury and past surgeries. That's one thing. And if you find your semen to be yellow, again we have to rule out lot of infectious etiologies, and properly we have to diagnose and treat the particular condition. Highly yellowish semen may indicate too much of pus cells in the semen. Again, it could be a urinary tract infection. You could have chlamydia or gonorrhea if you are in an unstable relationship, or if you are in a type of relationship you engage in sexual intercourse with multiple people randomly. So a risk of STDs have to also be definitely ruled out. So more than the consistency, the color of the semen sometimes becomes more important, and I'll make a separate video on that. But all said and done, if you find yourself ejaculating watery semen, please do not worry about your male fertility potential. Just go to the nearby andrologist or the nearby sexologist and take a semen analysis. That's all you need to do. Nothing more is actually required. Or give some gap. So now there are some studies which say that with repeated ejaculations, through masturbation or repeated sexual intercourse, done in a very small period of time or a small latency in between sexual intercourse sessions, the semen tends to become watery. And if you give a gap for about say a week or 10 days, you should see your semen consistency eventually become normal. So that's one thing you can definitely try. So don't get alarmed if your semen is watering. And I hope you enjoyed this video. Do comment, like and subscribe to our channel. Click on the bell notification icon, and do watch the space for many more videos. This is Dr. Shah. Vanakkam and Namaste.